It's very rarely that you have two experienced clinicians in one room treating a patient. Kings, the biggest confidant used to be their healthcare provider. I'm a bit old school. Like as I say, I graduated about, what, 22 years ago now. So I am a little bit old school in terms of that technology, I feel, is more of a tool that comes along with your general day-to-day providing of services. It is not a replacement for that humanly touch. That's very important. And to be perfectly honest with you, if I was to think of Smile Sensations at the pinnacle of what it can be, I would say, once again, my focus will be on patient handling, consultation, and planning. Because I feel that that is the most important part. And I feel that my clinics would be performing the best. Look, it's hard for me to compare my clinic with any other clinics or my personal performance as a dentist to any other dentist, because it's very difficult. It's very rarely that you have two experienced clinicians in one room treating a patient. So there is no way of comparing two people at the same time. It's a very personal thing, and so it is. That is what most of us as clinicians, we don't recognize, is that dentistry is very personal. And that is what it used to be, going back to like really ancient times, that even the kings, they used to have the biggest confidant used to be their healthcare provider. So healthcare providers are actually, it's a very personal thing. And over the time that I have felt that works really well is when you can bond with the patient and when you can develop that relationship where you understand what is their goal, what are they actually wanting to achieve. That's very important. And if you can develop that relationship, and if you have that knowledge base where you can plan and guide them through accordingly to achieve their best outcome, that is the biggest success for any dental practice. Because I think that is what is the true dental industry. It is not about doing a fantastic root canal treatment under, 20x microscope. It is not about that. It is not about giving, like I have personally seen average dental work performing very well and very happy patients. I'm not saying poor quality dental work. I'm not at all talking about that. Good, well-educated planning and execution of that. But looking at the things holistically is, I think, the pinnacle of any dental practice.
Get on your knees. Came from the jungle, up in the trees. I got a few tricks up in the sleeve. One wrong move, I'ma let out the big shoes, check out the crease. Blow like I'm Bigfoot, step on the beat. Make a man's run till he step out the crease. When the whole place scream, gotta get